Good morning, everyone. Thank you so much for joining us this morning. My name is Sylvia Flores. I'm with the City of Sunny Isles Beach. I also have with me Jessica Rourke, who's with the City of Sunny Isles Beach. And we are so excited this morning to be partnering with the All of Us research program at the University of Miami in a live conversation with Dr. Olveen Carrasquillo, Chief of the Division of General Internal Medicine at the University of Miami. Dr. Carrasquillo, thank you so much for joining us today.
Thank you. It's a pleasure to be with you guys. And I recently got kicked upstairs. I'm no longer Chief of General Internal Medicine. I direct our Institute for Clinical Translational Research.
Oh, wonderful. Congratulations.
Great. Just want to correct that. But again, thank you, Sylvia. And most importantly, thank you for the City of Sunny Isles Beach for putting on these very important informational sessions, critically important for our community. So thank you very much for doing that.
Thank you. We're excited today. We're going to be talking about COVID-19 variants, vaccines, and boosters. And before we get into some of that conversation, we wanted to ask you if you could tell us a little bit about what the All of Us research program is.
Yeah. Well, the All of Us, I mean, it kind of, I think, fits nicely with this. The All of Us research program is one of probably the nation's most ambitious research program, seeking to enroll 1 million people. It's the kind of study where what we call observational. We don't give you any drugs or devices. We just follow people for many years. We do initial tests where we ask you surveys about your lifestyle, your health habits, collect information about where you live and your environment. And then we get from blood, we get information about certain things in your blood, including a full gene analysis. And we link that to your medical records, and then we follow for 10 years. And we make many, many important discoveries about how your genes may interact with your lifestyle, with your environment. And we call it, it's going to inform medicine for the next 50 years once we gather all the data. But we really want South Florida to be represented. We don't want a study that coming up mostly out of the Northeast California. We really want a good sample of people from South Florida to be represented in this very important study.
And why would it be important for us to join, or those who are watching, or later, residents of South Florida to join?
Yeah, I don't have to tell anyone here listening to how unique South Florida is and how different it is. By diversity, people from all places of the universe basically live here. And we need that kind of a diversity. Many of the old studies in medicine were based on very homogeneous populations. A lot of them were predominantly men, predominantly white, that lived in very different circumstances for the ones we may live here in South Florida. So we really need to make sure that we have enough diversity that whatever comes out, it's generalizable to everybody. We don't want a study that says, well, men from Boston and this, we want it to be everybody in the country represented so we can make generalizable conclusions.
No, that's great that it's very inclusive. What would you say are some benefits for the participants in specific to join the research program?
Well, the most important, which many people don't think is important, but I do, is that you're actually making a major contribution to science.
Mm-hmm.
So that's critically important. But people for themselves, first of all, they have their genes represented, right? So whatever discoveries will come out of the genetic part of the study, it's your family, your family's genes, it's a gift that kind of keeps on giving to make your genetic profile. But people do get back results. Many people are very excited to get data on their race and ethnicity that comes back to them and says what proportion. Some people are shocked by it. And slowly over time, we'll be giving back more and more information. Some of the survey results will compare to other people, for example. And then eventually we'll get you some information about your genes and some conditions that you may want to know about. That may be, your genes may put you at risk for, and we'll provide genetic counseling and everything else that goes with it. But it is, we actually do share results back with participants, and, they're able to use that information as they see fit. But I was very interested to find out I'm 30% African. I mean, that was very interesting for me to know, for example. So yeah, people find that information also very helpful. But again, the biggest role is a big contribution you are making to science here. It's nominal. You only get $25 for participating. It's not a big incentive, but the incentive is the information you get back as well as your contributions to science. That's what really is a big incentive here.
No, that's great. How would you say the All of Us research program has helped with COVID-19 research?
Yeah, so we've done already, some of this data we had to analyze for COVID, and we found out that COVID was circulating a lot earlier than people thought, for example. So that was really interesting. It didn't happen, in February or March. Turns out it was circulating probably November. We just didn't know it. So it was already here. And also we're doing a lot of surveys about how COVID has affected our way of life and our lifestyle. So we're getting that data and we're going to be analyzing that. But long term, we'll also be able to see people that develop symptoms of long COVID or things like that. We'll be able to analyze that as well at some point. So certainly it is big on the agenda, even though we're still collecting the data, we still need to get to 1 million. We're still already finding out stuff that's very interesting.
That's what I was going to ask you. It's probably too soon to see that data just yet, right? You're still collecting?
Yeah, we're still analyzing some of it. There's a paper we're working on looking at cardiovascular health in Latinos. Some people used to think that Latinos have lower rates of heart disease. Our studies suggest the opposite, that we have similar or higher rates of heart disease as whites, for example. So we're already starting some analyses, but we still got to continue to build a cohort.
I see.
Very good. So we're going to get into some of our questions related to our topic today, COVID-19. And one of the first ones we wanted to discuss with you is about Omicron specifically. So is Omicron still the dominant variant in the US?
Yeah, I mean, with COVID, you just never know. Everything I tell you is what we know today. It surprises us in many, many ways. And every day we're learning a lot of new stuff. Yeah, but Omicron, hit us by surprise. We had Alpha over last summer, then we had Delta in the fall, and we thought we got over it. And then suddenly out of nowhere, Omicron came out and it spiked very, very sharply. We thought Delta was a very sharp spike, but Omicron was extremely sharp. And Omicron dropped even much faster than Delta, which is very amazing, which is what we saw in other countries with Omicron. But it is still the variant that's circulating, this one Omicron B2 that we're trying to keep an eye on. Some of us are a little bit worried about this new variant. But so far, the numbers look very positive. The numbers continue to go down, but we got to keep an eye. And whenever you see that curve starting to go up, all the alarm bells have to go off. We don't want it to be, we've been a little bit behind the curve. By the time we sound all the alarm bells, it's been a little bit behind. So as soon as we see those curves turn the wrong direction, we got to be very, very careful, because COVID, again, it'll hit us in 2 weeks like Omicron. I mean, in a period of 2 weeks, we went from nothing to, highest peaks we've seen during the entire epidemic. So I wish I could tell you Omicron is done, but with COVID, nothing is exact. So we're in a really good place right now, but who knows what's going to happen in the future.
Okay. And in regards to vaccinations, do you have to receive the latest booster in order to be considered fully vaccinated?
Yeah, I mean, one is terminology, right? Which is phrasing, and one is what your doctor tells you, all right? And as a doctor, I would say you need all three. You need the booster shot. We've seen with Omicron, the people that got vaccinated early and didn't get the booster, particularly the elderly and those at higher risk. I mean, they got admitted a lot with really, really bad Omicron this time around. But in general, even for regular people, we know that even with the booster, you still had some chance to catch Omicron, but it was still really, really protective against getting severe disease. And so that's why I would tell anyone that asks me, do I need the booster? The answer is absolutely. If you haven't gotten it yet, please get it, because you just don't know. It's critical before Omicron hit us, but I can't tell you what's coming next. What's the next wave? What's the next mutant? So I would say the best thing we can do to protect ourselves and our family is definitely get that booster. That's critical.
Okay, very good.
So for that booster, Dr. Carrasquillo, how long would you say does it actually provide that extra level of protection per se?
Yeah. And, that's where people forgot about the vaccine studies we did, like a year and a half ago or something. But those people are still coming in periodically. We're checking the antibody levels. We're monitoring them. So that's what's informing about, all these things, because we are following these people very closely. It's not like, okay, the study's over. And we know how long the protection lasts. We do know that when you have very, very infectious viruses, like we saw with Omicron, just the 2 doses, and, you start waning up some things, you really need high levels of antibody response. So, we think you're good right now, but the question is, will you need a 4th dose at some point? I personally think probably, but it's a little bit too early to tell. We're still looking at the data from these studies, analyzing the antibody levels, and who knows what that next mutant is going to look like, and whether we will need it or not. But probably the answer is probably yes, that they will start to decline. In the elderly, it looks like that's what's going to happen, but we're still seeing, I can't say anything for sure right now.
Right. And comparing, I would say, like natural antibodies that you see after you have had the virus and then compared to the vaccine and booster shots, is there anything?
Yeah, those are no good. So we've seen that the protection only lasts a few months, and we're seeing that it was very weak, almost, very little against Omicron, for example. So yeah, I would not buy or go about having a prior infection. You really need the vaccines, and you really need that high boost, because the protection is very temporary at best from having the disease.
From having the disease. Okay.
And can I ask, why are some people who are fully vaccinated and who even have the booster still getting infected? Does that have to do with the type of vaccination or booster that you got, or a combination thereof?
Yeah. Well, one is we've done a lot of studies about the combination, people who got the combinations. The studies weren't designed that way, but many people, for whatever reason, got different shots of different things. We did the studies here in the Janssen, which is probably less effective than the other two, but we're finding out that with boosters from another one, it seems to be really effective when you combine them. So we're following them. So it seems like combinations are good. You don't need to stick with just one thing. So they're very good. And the protection, is lasting so far. It looks pretty good for the people that got boosted, at least for a few months out after that. And I forgot, what was the other part of the question? One was about, why are people still getting infections?
Right.
Look, with Omicron, again, it was very infectious, very, very different. And certainly a lot of people got very angry that they got, COVID. The vaccines are not 100%. But I can tell you, most of those people stayed out of the hospital. They may have been sick for a couple of days. It wasn't 1 to 2 weeks like initially, and they stayed out of the hospital. But yeah, the vaccine is not 100%, certainly not against Omicron, but it's very, very good at keeping you out of the hospital.
Okay, very good. I think you touched on this a little bit, but you think that there will eventually be a recommendation for another booster shot in the future?
I can't say, that's my gut, but again, we go by science, not by people's guts, Unlike some political leaders, we have to go by the science. And at this point, I think it's a little bit too early to tell. We will have the science, and we'll definitely know that answer, but we just don't have it right now. We can't say yes right now.
Okay.
Switching gears, focusing on the children, what age do you think you recommend getting children vaccinated against COVID-19? What is that age recommendation?
There was some interest yesterday, obviously, all over the news. Our political leaders up in Florida seem like they're going to issue guidelines which have nothing to do with science. The data is clear. Kids over 5, that's who the vaccine is being immunized, and they should definitely get vaccinated. Thousands of kids have been admitted. Some of them get this post-inflammatory response, which is horrible. We know here in Florida, over 40 kids have died from COVID. So it's critically important kids 5 and over get vaccinated. The data is very strong. I'm not sure where, the governor's staff and the Surgeon General staff, what they were looking at, but clearly every reputable scientist has said absolutely not. Kids need to be vaccinated as well. The protection is not as strong as for adults, because it's true, kids are less likely to get sick from COVID, but we certainly know from lots of admissions, lots of deaths, that it is deadly in kids as well, and we need to protect our children just like we do adults. And the other thing people forget is that kids can also pass it to other people, right? Especially think of the people that have transplants, people being treated for cancer, they're very elderly. You don't want these kids to then pass it on to other people as well. So the vaccine is really 2 roles. One is to protect our children, but also to protect the most vulnerable in our society. The more we vaccinate people, the less chance there is to pass it around. So it has a twofold effect. And I think it's absolutely unconscionable that somebody would say that kids should not get the vaccine.
Great. I know we've been talking a lot about the vaccine, but are rapid at-home tests less accurate than PCR tests? What would you say the accuracy and differences between
the two? Traditionally, the problem with rapid tests was that they don't pick it up early enough. So that was one of the challenges. PCR tests were much better early on. People had an exposure, and the next day they got rapid antigen. Hey, I'm negative. And lo and behold, 5 days later, they were positive. So that was it. But we are seeing that with these new variants that are coming up, the rapid tests may be less. So I would tell people, if you strongly suspect that you may have it, certainly get both tests done. The rapid, you get the results right away in 1 hour, but if the rapid misses it, you certainly should get the PCR as well, because we're seeing very strange things with these new variants that are coming up. So yeah, it's, they're very helpful, the rapid antigen test, but they're not 100%.
Doctor, I had read some information that, basically was making the case that in the beginning, when you're trying to figure out if you've had an exposure, you're trying to figure out if you're tested, PCR is the best way because that, will pick up anything that you have. Whereas towards the tail end, you could use a rapid test because as long as the rapid comes up negative, then you really aren't contagious anymore at that point. Is there any facts?
Yeah, that's what we've been saying for a long time. It just looks like with this new variant, even later on, some of the rapid tests don't pick it up, which is very weird. But yeah, I mean, what you're saying is 100%. That's what we've been saying for the last several, months. But yeah, with this new variant, that's a little bit weird. Even later in the stage, it's just not picking it up. So it's we have to monitor, right? We don't know. This is all very preliminary. This is sort of like hot off the press. This new variant started coming out in the last few weeks. So we still have to do more work on it, but that seems to be what we're moving to, that don't rely as much on the rapid test with this new variant, even at the tail end of the disease. But again, if you've been exposed, it's best to stay away, wear a mask, stay away from other people until you can confirm it. It's just, you don't know. Again, with these new variants, you just don't know. That's what I'm saying with COVID, all bets are off, but exposed up, certainly, protect other people.
Okay. And in general, if you haven't been exposed, what are the recommendations currently as far as masks?
Yeah, so it's a little bit different in healthcare settings from non-healthcare settings. The CDC just issued, new guidance about masks. And it looks like in most settings, you don't need to wear masks anymore. But people ask me, look, if I'm in a crowded indoor stadium, like a movie theater with hundreds of people, should I wear my mask or not? I'm like, well, that depends on your risk tolerance, Certainly masks to provide some protection, and that's important. And certainly if you suspect you've had exposure, you suspect that you've been in contact with somebody, you may have early symptoms, certainly wear a mask. People forget, masks are good for you, but masks are even better at preventing you from spreading it. And a lot of the mask debate has been lost. Again, I don't know where governor or surgeon general are on this whole mask thing, because it's clear masks are extremely effective against preventing you from spreading it. So masks are clearly important in that sense. It's not just to protect you, but it's to protect the others around you. It's part of our responsibility as citizens to make sure we protect everyone else.
Okay, very good. So our next question is about some more variants, and I'm sure there's still a lot to learn here, but will new variants potentially become increasingly transmittable and harmful, as we saw, you mentioned Alpha and Delta, and then Omicron seemed to be the most infectious thus far, and the spikes were crazy. Do we anticipate continuing to see that kind of exponential?
Yeah, I mean, people talk about the variants that are contagious, but the virus keeps mutating in many, many different ways. The virus keeps mutating, man. There's lots and lots of variants that are not, dangerous to humans that we don't even follow. So there's many variants. It's, when they become a concern, that's when we start following them. And certainly we've seen these two, Delta, now Omicron, major concern, major infectiousness. There's some concern that may happen, but I'm not going to go out on a limb here. I don't know. But clearly that is what we're all worried and concerned about, that new variants that are even more infectious and more easily spread can come up. But that's why we have to keep our guard up and making sure that we keep doing good public health surveillance to monitor this, because if that happens, that would be very, very bad for us.
Mm-hmm.
Have you noticed any different symptoms or stronger symptoms with the new variants coming up with Omicron?
It's hard. A lot of people have had milder symptoms, but it's not clear whether that was, just because they were all vaccinated already. Certainly most of the people reach out to you. We've seen more nasal symptoms with this variant that wasn't typical with the other ones. So that was a little bit different from the others. We certainly saw a lot less of the COVID pneumonia with this variant. But again, that's probably because most people were vaccinated already that we've seen. But it does look at a slightly different profile. And the question is, what's the role of vaccines and all that?
Correct, right. We have another question about the immunosuppressed population. Should persons who are immunosuppressed have a second booster? Is that something that is recommended?
Officially, I would say check with your doctor, depending on your condition. Certainly, they should all get the booster, but yeah, I've heard talk about some people that are immunosuppressed, and if they got their booster very early on, because these are the first people we vaccinated, the first people, I would say check with your doctor, definitely. I would also say that if we see that curve starting to trend up, and we see some new variant that's starting to come up, that would probably push my hand for my own patients if they ask me, hey, look, I see the numbers are going up. My booster was, I forgot when we started doing the booster, 4 to 5 months ago. Should I get another one? And I don't know what the CDC would say in that case, but I may be twisted in my arm to say, yes, you should get that 4th booster. Right now, I don't have anything really solid to go on to say that. The evidence is not there, but again, we'd be talking not science, but my gut. And if I saw the numbers starting to go up again and somebody who got boosted a long time ago and asked me, I may say yes.
Okay. And still based on your gut, probably I would imagine too, would you say there's any better versus Pfizer or Moderna or Johnson & Johnson for the booster? What would you say?
Yeah, I mean, it's the booster. So we're still doing a lot of studies about the combos. There's some early evidence that combinations may be good. Certainly with the Johnson & Johnson, we're seeing that coming out with the booster, that if you boost the others with J&J or the other way around, it may be better. But it's very close. It's not as big a deal as getting the booster versus no booster. I mean, that there's no dispute that the booster is very protective. Officially, I think the manufacturers still say try to get boosted with the same one you got before. So if you got J&J, the second J&J, and the same. But a lot of people are saying that combinations may be very good as well, or if not better.
Oh, okay.
When it comes to the vaccine for children, is there evidence that one is better over the other, has better results in the younger ages?
Pfizer is the one that's really been studied the most. I haven't really looked at the Moderna data yet. So I mean, the one that we all know right now is the Pfizer for kids, and that's the one that we're recommending. But I'd have to go back. I'm not as familiar with the Moderna numbers. Those I haven't seen yet.
Okay. And we do have we have a couple of questions from the public, and you've addressed a little bit of this along the way, but I just want to clarify for them. So one of them is our children are not getting admitted to an out-of-state camp due to lack of vaccination. The children are ages 12 and 7. Would you recommend their vaccination at this age just for the sake of the camp?
No, I would recommend it for just recommending it. They should be vaccinated. Absolutely. It's not about going to camp or not. Certainly, if you're going to camp, you don't want to have a COVID spread event. So it's critically important for camp. But even if they're not in camp, they're still going to school. They're still around the elderly. They're still around other people, and they are themselves at risk. So they should absolutely be vaccinated, whether they're going to camp or not. It's a big push in our group, the Florida Community Engaged Alliance Against COVID. We are really trying to emphasize to parents the importance of vaccinating kids. We know the vaccine is safe, and we know it imparts protection, and it also helps prevent spread. So absolutely.
Okay, very good. Another question, actually from Facebook right now, somebody watching, what are considered good antibody level numbers?
Yeah, long debate on that, and it depends on the virus and depends on the infectivity, as we saw with Omicron. What's good for one may not be good for another. But I tell people is please stop following. I get my patients all the time. What's my antibody level? We don't know, but we don't know with these variants. Just get vaccinated, get boosted, and that's what we go by right now. We're not checking antibody levels and say, hey, it's too low, let's give you another dose. That's not what we're doing right now clinically. Just get the vaccines and get your booster. Because of COVID, it's hard to predict what are adequate levels of protection from antibodies.
Okay, well, you kind of answered that. The next question was similar to that. So does it make sense to check antibody levels to see if it's time to get the booster again? And so you're saying,
We're not doing that right now. A lot of patients reach out to me. I don't know what's being spread out there, but clinically it's just get the 3 shots up and we'll see. What I want to emphasize, this is a very moving target. Science keeps moving. I mean, the science on this has been incredible. It keeps moving at a pace we've never seen before. New data comes in, and we will make recommendations. I mean, people have to review this and then make the best recommendations based on the science, which is critically important. What I'm concerned about is, when, political leaders take a very biased group of people and they make recommendations based on, it's got to be based on the best science and the best data, not trying to send out any political messages.
Understood. Okay, and actually, I think that wraps up. Someone was asking if this conversation would be recorded and available for viewing afterwards, and it absolutely will. We are recording this and we'll make it available on our Facebook page and our YouTube page later on. Jessica or Doctor, if you don't have anything further, I think that's about everything we have on our end.
Yeah, no, again, I thank Sunny Alice for doing this. The Cape Cod message is please get your booster. Only about a third of adults have gotten their booster. And even the initial vaccination rates are very low in young adults and in children. So certainly if you haven't gotten any vaccines, please make sure children 5 and up, teenagers, definitely need the vaccines, and everyone needs, if they're up for the booster, to get the booster. I mean, it's critically important because we just don't know what's next, and we don't want to be behind the curve. I mean, it really hurt us, working in the hospital, admitting a whole bunch of people that just refused to be vaccinated because they believed a lot of the stuff that's out there on the internet and Facebook, and they come very close to death to the hospital. They can't breathe, horribly low oxygen levels, and it's very frustrating that they have something entirely preventable, and because they listened to a Facebook post, they didn't protect themselves.
Mm-hmm.
So please, let's protect ourselves and let's protect our loved ones. It's the best thing we can do.
Very true. Very true. Thank you, Dr. Carrasquillo. Thank you so much for your time today. And thank you to everyone who joined us to watch. If there's any questions that we happen to miss, we will answer them in the comments afterwards. And we hope you all have a great day. Thank you very much.
Pleasure to be with you. Thank you.